Hey guys, Dr. AJ here with Stronglife Physiotherapy. Meniere's disease is a debilitating condition that affects hundreds of thousands of people. Treatment options are limited, but there's evidence that a natural and inexpensive option for Meniere's disease exists and can be very effective. It's a couple vitamin supplements that have some interesting research to back them up, but there are some specific things you should know before taking them, so make sure you watch till the end to get all the information you need. How do you know if you have Meniere's disease? It's best to go to an ENT or a neurologist for a specific diagnosis, but there are four main symptoms you will likely have if you have Meniere's. They are spontaneous episodes of vertigo, which is a spinning sensation that lasts between 20 minutes and 4 hours. You might find that you sweat, get nauseated, and vomit. Not fun. It's important to note that if your spinning lasts for about a minute or less, it's probably BPPV and not Meniere's disease. BPPV is actually much more common. The next main symptom you will have is hearing loss that may come and go. You will also probably have tinnitus or ringing in the ear and a feeling of pressure or fullness in the ear. These are the main symptoms of Meniere's disease. You will most likely be given the option of medications and surgery. The medications can be helpful, but will have side effects and will not get to the root cause. The surgical options can be very effective, but they are very invasive and can result in permanent hearing loss, lingering balance problems, and other complications. If you're looking for a more natural way to help with Meniere's disease, I want to present you with a very safe, effective, and affordable option. It is the use of vitamins to possibly heal your inner ear. There was a study done all the way back in 1940 in which 20 people with Meniere's disease were treated with niacin and thiamine. So this is vitamin B3 and vitamin B1. Of the 20 people in the study, 17 had their vertigo symptoms completely reversed. The other 3 had noticeable improvement in the frequency and intensity of their vertigo attacks. In 10 of the cases, the tinnitus was cured and greatly reduced. In the other 10, 12 people in the study showed an improvement in hearing. All they did was take 250 milligrams of niacin and 20 milligrams of vitamin B1 every day for 2 to 3 months. In the study, they also recommended a high protein diet and a high vitamin diet, or just a nutritious diet. The thing you need to know about niacin is that it will cause a flush reaction. This can be alarming if you're not expecting it, but now that you know that it's coming, it will be much better. So it starts as a warm prickling feeling in your forehead and works its way down your face, neck, and upper body, sometimes going down to your legs as well. The higher the dose, the more the flush reaction, so it's okay to start with a smaller dose. It also helps to take it with food. Most people stop flushing or have only very mild flush reactions after taking it for a few weeks. Niacin also had the wonderful side effect of lowering your LDL or bad cholesterol and raising your HDL or good cholesterol, and there's also mental health benefits. You've got nothing to lose by trying this Meniere's vitamin protocol and a whole lot to gain, so I hope you'll consider trying it. You don't need to take any specific brand of vitamins for this to work, but if you'd like a recommendation, I'll put a link in the description. And as always, make sure to check with your doctor before adding new supplements into your routine. Thanks for watching. Please like and subscribe if this was useful, and please share this if you know someone who is suffering from Meniere's disease. Have a great day and stay strong.